My name is Jack Smith. I live in the 9th District. I'm not here as a candidate. I'm here as a citizen. I have two questions. Number one, in the executive order that was signed, that gained your vote, that was signed by the President, the blogs and several of the websites this morning are explaining that the Secretary of Health and Services, Civilis, is going to sign something which will repair the inaccuracies in the preconditioning treatment for children. What makes you think that either of those two documents is worth the paper they're written on? Number two, I was here at 12:30 this morning waiting to come in to see you explain exactly what your positions were on this health bill. I was told that at that late time by security at the library that you had canceled this event. The security was kind enough to let me use their phone, and I called your office. My second question to you is, why should any citizen, why should any taxpayer be lied to by someone out of your office? When I called and talked to your secretary, she told me she had no idea what I was talking about as far as meeting schedule for the library. I knew better. I asked to speak to the supervisor in your office. I got the same response from him. When I asked if she had any scheduled public appearances today, he gave me about 3 different answers about where you would or would not be. I was told as late as last night that there were 2 scheduled events for you today. This one at 2 o'clock and also a public meeting at Bowser High School where you're going to be meeting with the Civic Affairs class. I reiterate, why should any tax-paying citizen be lied to by a staff that we are paying their salaries for? You do not have the courage to face us. You put those folks between us, and that is absolutely unacceptable.
Yes.
Does anyone else have any further questions? I have several that didn't get covered.
Can I do a repeat? Can I do?
No, we're not getting any more Viagra.
I object.
This gentleman has, and then I think the young lady here, and that young lady, and then I'll ask my questions toward the end.
Up to the microphone. Right, I'm just letting everybody know that my concern has to do with people my age, Medicare. Okay? I joined Medicare in May of this year. There'll be nothing left.
Look at illegal.
No, that's my wife. Congresswoman Kaptur, again, I'm here, Tom Nowak, lifelong resident of Toledo, and of the many concerns I have with respect to the health care bill, the one that is really unbelievable, in addition to the provisions of abortion with that so-called executive order, I am adopted and it makes me sick. That's a different issue. But with respect to Medicare, you have purported to be a backer of senior citizens for years and years and years. You never missed a meeting. We never knew where you were, but you never missed a meeting of seniors. Well, good for them. But the truth is, now seniors are going to be stabbed in the back because of this legislation, which will take away $500 billion from Medicare. And it's been looked over by the media. Nobody talks about it. $500 billion. Now you tell me, what kind of impact will that have on Medicare recipients who will be forced to pay more out of pocket because Medicare won't cover it, the physicians will require it, probably just to pay their electric bills by that time. Yet this big that people like me have paid in our whole working lives. And now, when we need it, you're taking away $1.5 trillion. How do you justify it? Thank you.
Ms. Kaptur, this is Marilyn Oliver again. I'm sure your office staff knows me very well. I have been in there several times and talked to Dan Foote about Thailand veteran issues. My concern is for the veterans. I understand supposedly there is some bill going through Congress that is going to guarantee that the veterans' health care will not be touched or be affected by this new bill. I don't believe you. I believe that everybody who is over the age and is able to collect Medicare is going to be in a sad state of affairs. When you're going to cut that much from the budget, how can you not have rationing of care that is already going on in the VA system? Veterans, a lot of veterans are not even allowed to get into this VA to have services taken care of. What services are provided, sometimes they're too late, or they're delayed, or they wait till their end of the time and then they say, I'm sorry, but there's nothing more we can do for you. That is the same thing that's going to happen with this bill. There is going to be rationing care. You're taxing the Medicare system for every little thing. Every time you turn around, there's going to be a tax on Medicare. How can you, in good conscience, is that why you're not here today, that you cannot face your constituents eye to eye and tell them why you really voted for this bill? I think you're a coward, Ms. Kaptur, and I'm tired of it. We need representatives that are going to represent us, and they're going to pay attention to the Constitution as it was made. We do have principles and values that you do not have.
Ms. Kaptur, I am Nancy Fisher from Ottawa County, who came out and got me along the lake. I would like to know what this bill is going to do to small businesses, since my 2 children run small businesses at this time. The taxes they are under right now are absolutely breaking them, and small businesses are barely able to hang on. Also, what are you doing with the money that is being charged with the taxes and such? Is it going to be like Social